Your rotator cuff isn't just one muscle. It's actually a collection of 4 muscles that work together like a team. These 4 muscles connect your humerus, that's your long arm bone, to your shoulder blade, and they're absolutely crucial for keeping your shoulder joint stable while allowing you to move your arm in all those amazing directions we take for granted. Now here's what I want you to understand about rotator cuff tears. They're incredibly common and they can happen to anyone. Chronic pain creates what we call a vicious cycle. The pain affects your mood, your energy levels, your sleep, and even your outlook on life. You might start avoiding activities you love, which can lead to isolation and even depression. This is why getting proper treatment isn't just about fixing your shoulder, it's about protecting your overall quality of life. Today, we're talking about one of the most common shoulder injuries I see in my practice, rotator cuff tears. If you've ever fallen down with outstretched hands during sports or even been yanked by your dog on a walk and felt a sharp pain in your shoulder, or if you've been waking up at night because you can't sleep on that shoulder, this episode is for you. Let's start with the basics. Your rotator cuff isn't just one muscle. It's actually a collection of 4 muscles that work together like a team. Think of them as the foundation of your shoulder strength and stability. You've got the supraspinatus, which helps you lift and internally rotate your arm, the infraspinatus, which helps with external rotation. There's the teres minor, a smaller muscle that assists with rotation, and finally the subscapularis, which helps lift your arm to the side. These 4 muscles connect your humerus, that's your long arm bone, to your shoulder blade, and they're absolutely crucial for keeping your shoulder joint stable while allowing you to move your arm in all those amazing directions we take for granted. The shoulder is the only free-hanging joint in the whole body. Now here's what I want you to understand about rotator cuff tears. They're incredibly common and they can happen to anyone. But the good news is that with the right approach, most people can get back to doing what they love. So how do you know if you might have torn your rotator cuff? The signs are usually pretty clear. You'll typically experience shoulder pain when you try to lift your arm overhead, like when you're putting on a shirt or you're reaching for something up high. You might notice weakness in your shoulder, and here's a big one that really affects quality of life: pain when trying to sleep on your affected shoulder. I can't tell you how many patients come to me saying they haven't had a good night's sleep in weeks because every time they roll over, they wake up in pain. This sleep disruption isn't just inconvenient. It actually affects your body's ability to heal and can impact your mental health and overall well-being. Let's talk about what causes these tears. For my athletes out there, swimmers, baseball players, quarterbacks, you're particularly at risk because of the repetitive overhead motions your sports require. But don't think this is just a sports injury. I see plenty of rotator cuff tears from everyday activities too. Maybe you fell and caught yourself with an outstretched arm, or you were walking your dog who got a little too excited and yanked you, or perhaps you're dealing with simple wear and tear as you age. The reality is our rotator cuffs work hard every single day, and sometimes they need a little help. Here's something I want to emphasize, especially for those of you who might be putting off getting that shoulder pain checked out. When you're dealing with a chronic pain from an untreated rotator cuff injury, it doesn't just affect your shoulder. Chronic pain creates what we call a vicious cycle. The pain affects your mood, your energy levels, your sleep, and even your outlook on life. You might start avoiding activities you love, which can lead to isolation and even depression. This is why getting proper treatment isn't just about fixing your shoulder, it's about protecting your overall quality of life. Now let's get to the good stuff, how we actually diagnose and treat rotator cuff tears. When you come to see me, I'm going to do a careful examination of your shoulder. We might need some imaging studies like an X-ray to rule out other issues, and definitely an MRI to get a detailed look at your rotator cuff. Here's where I want to bust a myth. Not every rotator cuff tear needs surgery. In fact, many of my patients with partial tears do beautifully with conservative treatment. We have a whole toolkit of options available. First, let's talk about physical therapy. This isn't just about doing a few exercises. It's about strategically strengthening those small muscles around your shoulder to support the injured area and restore proper movement patterns. I often combine this with anti-inflammatory medications to help reduce pain and swelling. One of my favorite treatment approaches involves exercise you can do at home, sometimes with bands. These aren't complicated, just simple, targeted movements that gradually restore strength and flexibility. The key is consistency and proper form. For some patients, we might use cortisone injections directly into the subacromial space. These can provide significant pain relief and allow you to participate more effectively in physical therapy. I'm also really excited about some of the newer regenerative treatments we're offering, like platelet-rich plasma, or PRP, therapy, and stem cell therapy. These treatments use your body's own healing mechanisms to support tissue repair. While the research is still evolving, many of my patients have seen excellent results with these approaches. Now, for full-thickness tears, or when conservative treatment isn't providing enough relief, surgery might be the best option. The good news is that we can often use minimally invasive techniques, which means smaller incisions, less tissue damage, and faster recovery. Surgery can be truly life-changing for the right candidate, giving you back function you thought you'd lost forever. Here's what I want you to take away from today's episode. The right treatment choice is going to be different for every person and the activity level that you have. It depends on the cause of your tear, the type of injury, what symptoms bother you most, and what your goals are. This is why it's so important to work with an orthopedic surgeon who really listens to you and can create a tailored treatment plan that fits your priorities. Let me give you some practical tips you can start implementing right now. First, if you're experiencing shoulder pain, don't just push through it. Pain is telling your body that there's something going on and you need attention. Second, if you sleep on that side, try putting a pillow between your knees and another small pillow to support your injured shoulder. Third, avoid those overhead activities. Those can cause pain until you can get properly evaluated. And here's a big one. If you're an athlete or someone who does repetitive overhead activities, prevention is key. Incorporate those shoulder strengthening exercises into your routine. I know they are boring, but focusing on that proper form and not ignoring those warning signs is going to help you go a long way. Remember, your shoulder is incredibly complex and incredibly important for almost everything you do with your arms. Whether you're hugging your kids, carrying groceries, working at your computer, or pursuing your favorite hobby, your shoulders are involved. Taking care of them isn't just about avoiding pain, it's about maintaining your independence and quality of life as you age. The most important thing I want you to understand is you don't have to live with the shoulder pain or push through it. Whether you're dealing with a minor tear that can be treated with physical therapy or a more significant injury that might benefit from surgery, there are effective treatments available. The key is getting the right diagnosis and working with someone who can guide you through all of the options. If you're currently dealing with shoulder pain, I encourage you to get it evaluated. Don't wait until you can't lift your arm or your pain is keeping you awake every night. A frozen shoulder is much harder to deal with than a shoulder that's moving that has a minor tear. Early intervention almost always leads to better outcomes. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.